Hi guys, welcome back to my channel, Life of a Caribbean Nurse. It's your girl Nurse Ray. And today we'll be doing the topic pre and post-op management of laparotomy. So pre and post-op management of laparotomy. Guys, remember to like, share and subscribe to my channel. Tell a friend about it. Remember to click on the notification button that you receive all the videos as they are uploaded. What is laparotomy? Laparotomy is a surgical procedure that is usually performed to either diagnose a medical condition or to fix a medical problem. Alright, so any cut on the belly that an individual receives to either look in our belly to see where I go on or to fix a medical condition that is already existing is considered a laparotomy. Alright guys, so remember I said to you now that we're going to be doing pre and post-op management of laparotomy. Pre-management of laparotomy would be basically the care that you get before the surgery is done. So pre-management would be the care that you receive before the surgery is done. So it has to do with the prepping, it has to do with consenting the patient, it has to do with talking to the patient about the surgery, what's going to happen, the type of surgery that they're going to be doing, what is needed to be done before the surgery. So if them belly need to shave, if they need to make sure so they put in a UCAT, anything that needs to be done is usually discussed in the pre-op management. Post-op management now of laparotomy is the care that individual receive after they need the surgery. So after the surgery is done, the care that is required for the patient is considered the post-op management. As I said, post is after. Alright, in pre-op management for a patient that's about to do a surgery. So basically a patient preparing for a surgery. I'm going to give you it from two points of view. From the patient doing the surgery and from a nurse taking care of the patient that's about to do the surgery. Starting with the patient doing the surgery. Alright, so certain things as a client you have the right to ask about, right? One of them, doctor, will mobility be a problem? Meaning, I gotta have difficulty and move around after me do the surgery. You need to know that. If you're going to need special assistance at your home when you go home after the surgery, you need to know that also. Will there be special medications that you need to be taking after the surgery, right? What else? Let me see. What are the possible complications of this surgery? So you know what you're getting yourself into, right? Things that you should avoid, to support better recovery during the surgery. So you ask the doctor, when I do surgery, I still can go down the gully, go cut out the whole of the banana root them and dig them up and replant them. I still can go lift up the big stone and I always lift and move when time my husband come in. You ask the doctor all these necessary questions so you know what you ought to do and what you're not supposed to do after the surgery is done. Alright, as a nurse now, there's certain prepping that the nurse has to do for her patient or his patient, because you have male and female nurses. Alright, so doctor write the order and you go and ensure the order is carried out as a nurse. So say most time at about 10 p.m. different time based on the surgery, you might ask the patient not to be eating. Sometime a day before, it depends on the type of abdominal surgery. It depends on the type of laparotomy that the patient is doing. So then tell them say after a certain period of time, no more eating or drinking. They ask them to bathe and clean the area, sometimes with special cleaning agency. The nurse might be required to go and shave his or her patient before the surgery. Also, there are certain labs that need to be done. So you need to know, so you need to check on the person HB level. That means the amount of red blood cells, if you the HB alright. That means if this patient HB is low, you know that they're going to possibly needing blood. So they have blood donors that then consent for blood. If they consent themselves, that means that if they go in and they start to lose a lot of blood, doctor can give them back. If it is that they're going to do the surgery and they need blood donors, you get the blood donors come in and do the donation and take the papers to show that they have actually donated blood. Sometimes the patient is required to do enema. So as I say, then maybe the bowel might not be fully empty. So an enema is done to further empty the bowel. Alright? Also, if you can't go in a surgery with makeup, So if you realize they have one pretty gold teeth, you're going to tell them to take out the fake gold teeth for now until after the surgery and they're recovering or they have recovered, then you can put in back them gold teeth. You don't go into surgery with makeup. So you tell good girls, say, all right, you're going to surgery. So you rub off your makeup, you take off the eyelash and something. You take off all the necessary apparels that is not going to aid in the surgery going any better. All right. Also, advise them that if, yes, I said this already, dentures. So they have, teeth in them, then take it out. They having any prosthetic, you make sure they take it off. Anything like that, you ask them about all the additive that they having. And when you find out, you make them take it out. What cannot be removed, you advise the doctor. Or most of the doctor asks them to, so the doctor maybe would have been aware, but make sure you ask them because sometimes something slip one staff and then you pick it up and you help this patient further. Okay guys, so it's important to know that what I mentioned with the preparation for a surgery before was in an ideal setting, where it's not an emergency. In the case where the surgery is an emergency, a lot of these prior preparation would not be able to be done, right? In a sense where the patient would not get to sit down with the doctor in an emergency surgery and do before and prepping. However, consent still has to be signed. The patient still have to be cleaned. The ear still has to be prepped properly. You understand? All of that still has to be done. But the fine details go sit down with the doctor the day before and stuff cannot be done in an emergency surgery. Also, I spoke mostly about the HB. There's a lot of other examinations that are done prior to a patient going into surgery. ECG is done, right? Electrolytes are done. So overall blood is not just the HB, right? Tests are done to ensure that they know what they're going in for, what they're going in to take out. They know exactly what is going on. So a lot of other examinations are done, though I only spoke of the HB. You guys can look at the slide and you'll see where the other examinations are also mentioned. Also remember, it's important to do further reading. There are many different types of laparotomy surgeries that is done on the abdomen. You have appendectomy, you have cholecystectomy, you have small bowel resection, you have many different types. I've listed some below and also, or rather on the slide, and also the definitions are beside them. Also, I put a diagram up which show different areas on the abdomen that incision is usually done, and it tells you the type of incision, the name of the incision. So you have midline, you have lands where they normally do appendectomy. They have many different types, so you guys can pause the video and take a look at them. Also, remember, I tell you guys that you can get this slide if you guys so desire. Alright? Alright, so we're going to the post-operative management of laparotomy. Alright, so there are certain common management that is done. Now, cure the type of incision on the belly that you're doing or the type of laparotomy that was done. There are certain management and monitoring that has to happen. Alright, one of them, monitor the vital signs. So you monitor the temperature of the patient, the pulse rate, the respiratory rate, the blood pressure, and the level of oxygen within the body. You monitor the drainage. So sometimes you have drainage tube that is placed directly into the site where the surgery was done. They monitor the drainage, the type of drainage, and the amount that is coming out. Sometimes you find that they might insert a nasal gastric tube down through the nose into the stomach. You also monitor the consistency, the color of what is coming out. You monitor the amount that is coming out, and measure it, and so on and so forth. Pain management. A person just get an incision on the belly and just cut your belly. Naturally, when all the anesthetics wear off of this patient that was given at theater, this patient is going to be in a level of discomfort, pain. So medications are going to be prescribed for this patient. Ensure that the patient get all their medication on time to manage the pain well. Alright? And also, as a nurse, there's diversional therapy that you do. So when you give the medication and maybe the medication don't start to work, at the same time, you can turn on the TV, allow them to watch TV in the meanwhile, talk to them in the meanwhile. Just give them diversional therapy to take their mind off the pain until the medication start to take effect. All right, so when this patient is discharged now and at home, self-care continues at home. So when you leave the hospital, no matter if you don't go home, all right, me in the hospital again, so I said done. You still have to continue to take care of that wound now, So number one, ensure that you follow the exercise tips according to what the physiotherapist gives you prior to leaving the hospital. So whatever exercise tips the physiotherapist gave you, follow them, right? Visit your doctor immediately if you realize that the wound becomes tender, inflamed, and start to have discharge. These are usually signs of infection. So if you realize that the wound get tender, it inflamed, it have one because it start to smell, discharge start coming from it, it's not normal. Visit your doctor. All right? Take your medication as you were instructed. I stated that already. When you're home, all of the antibiotics you get to take them as you are instructed and take them until they're finished, even when you feel better or they don't look like anything wrong with the wound side. Take your medications until they are finished. Make arrangement as need be for assistance at home. So say alright, you just do a surgery on the abdomen. You're not supposed to be lifting anything heavy or push down heavy around the place. So you make necessary arrangement as a patient, So you call up John Tam or Sister Punzi and ask her, Sister Punzi, may I beg you come help me out of the yard now because I just did a surgery. I'm moving around on every single thing, but I'm not supposed to be lifting any heavy equipment or any heavy tool or pushing anything around. So may I beg you, please, may I beg you come help me out today because I want to go cleaning. Alright? Guys, as with any other procedure, there's always a risk for complication. Some of the risks are complications that can develop in laparotomy. You can have hemorrhaging, that's bleeding. You can have adhesion developing. You can have infections. Other things can go wrong as well as the surgery can go quite fine and no complication occurs, right? So it's always important to have a talk with your doctor, speak with your nurse, state your concerns so you guys can be properly informed before you go into whatever surgery or procedures that you guys are planning to do. Okay? Do have yourself a blessed one. Hi guys, I hope you guys enjoyed the video a while ago. I hope it was helpful to somebody out there. Guys, you can comment below, share on a topic that you'd like me to talk about. This was just a brief talk about laparotomy. Go and do more detailed reading. I really do hope though that it helps somebody and that if I even one thing you learn, I am still grateful for that. God bless you all. Have yourself a good week, a good month, a good year.